All right, bonjour. Welcome back. Welcome to those of you just joining again to the 5th annual Growing Resilient Communities Gathering of Tribal Nations and Collaboratives Addressing ACEs. As we get started, I want to remind you, we have a family-wise staff person at the ready to help with any technical issues that might come up during our sessions today. You can go ahead and direct message them. They're labeled as tech support on the participant list. And shoot them a message if you're having any issues, and we'll try to troubleshoot those with you along the way. We are having a little bit of difficulty right now with our closed captioning. We will continue to try to solve that issue, and we do apologize for that at this point. It is my honor to introduce today's keynote speakers, brothers Jerry and WENDELL WAUKAU from the Menominee Nation. I've had the opportunity to learn from these gentlemen before when they shared their story with us and tribal partners across the state at our Tribal Near Science and Community Wisdom Gathering back in 2018. We so appreciated their time and wisdom, their energy, hope and inspiration, concrete solutions, and track record of success they shared with us. And it is our pleasure to welcome them here today. So Jerry is the health administrator of the Menominee Tribal Clinic, and WENDELL is the superintendent for the Menominee Indian School District. Their cross-sector collaboration and leadership has created meaningful change within the tribal nation and beyond, having been recognized nationally as a Robert Wood Johnson Foundation Culture of Health Prize recipient, as well as numerous other validations at the state and national level. The full bios of our keynote speakers, along with all the presenters today, can be found on the Gathering website. We have reserved the time at the end of this session for Q&A. So while you're listening to the presentation today, when questions arise, we welcome you to put them right into the chat. And if it makes sense, Jerry and WENDELL might address them at that time. Otherwise, what we're planning on doing is reserving all those questions for the very end. We'll be gathering them up in a document, and we'll do some facilitated discussion after their presentation. So without further ado, please join me in warmly welcoming Jerry and WENDELL WAUKAU as they share with us Menominee's journey to a culture of health.
Okay, well, bonjour, everyone. Posomi, good morning. And Jerry and I are both honored to be here. And we are going to switch over here right away to the presentation because we realize we have a lot of content, and certainly we want to make sure there's time for Q&A, and we don't want to be doing all the talking. So I'm going to switch that over right now. So bear with me. Show. Does it say it present? No, from beginning. There we go. All right. Okay, so we're going to go ahead and get started. And again, we're just honored. And before we even start, we, in the Indian way, we want to make sure that, part of our story has to do with people that or organizations we've met along the way, and we just want to share with you, first of all, to DHS and FamilyWise for willing to hear our story. And as you can see, our connections over the years have led us with others. One of them happens to be right in your backyard, one of our consultants who's been working with us for over 10 years, Jody Favre.
And also, we've done some work with Robert Wood Johnson. I mean, we got to it forward back in 2005. But to this day, I think me and WENDELL serve as a couple of their ambassadors for some of the work we're doing. So hopefully we will be able to pull this together and share the work we've done.
Okay, so just a little bit to set the stage here of who we are. We've got some pictures of our families, but we actually—
WENDELL, I apologize for interrupting, but we can't see your slides at this point.
What's that?
We're not able to see your slides.
Oh, let's see. Yeah, you want, okay, here, slideshow. maybe it's present online.
Yeah, so there's the Zoom bar at the bottom of the screen with the green share screen menu.
Yeah.
I know it's hard sometimes when you have a lot of things open. Troubleshooting tech is always one of those issues.
See anything now? You're not seeing the screen?
Nope, not yet.
All right, go to slideshow. You want to go get her?
They shared with me their tech support's right next door, so.
Our screen is, I guess I'm not seeing why.
Did you hit share?
Right within the Zoom app, there should be that black bar at the bottom.
What's that?
So right within your Zoom app, there should be a black bar at the bottom with a green share screen rectangle. And we also have your slides, so we're welcome to, or we're open to bringing those up for you too.
What? Yeah, I'm just wondering now. Let's see here.
Maybe that might be better, Lindsay.
Yeah, let them know.
Yeah, why don't we just go ahead and have you do
Okay.
it? We'll just say next slide. I apologize.
Yeah, no worries. These things happen. So if the two of you want to continue, Emily has it going on right here. And we'll just go from there. Miigwech for everybody's patience and grace.
Okay, I guess I need to see our slides. All right, now I don't know how to make these bigger now. There we go. All right, again, we apologize. I think as we mentioned, we had some thank yous of acknowledging people. And of course, we need to make up time. So next slide, please. So just real quickly, you know, we're very fortunate that in our roles as a health administrator and a school superintendent, you know, that has brought our work together. But fortunately, I think what it really comes down to is how we were raised by a mother who gave us a strong foundation, but really schools and healthcare, maybe two brothers, but we just have one vision.
And just to point, I think our elders played a big part in it. We had an uncle who was really instrumental in our development. So when you have some of the missing fathers in our circles, he basically guided us and gave us kind of that wisdom that someday I expect big things out of you. And he was right. So hopefully we can listen to some of those teachings. And we're ready to show a few pictures. So go on the next slide. He kind of added this, so if you look towards the left, those would be my circle of influence, which basically is the guy with the Kansas. He probably wore it because they won a championship, but he was my grandson that I took in when he was 2 years old, and he is now 17. And part of the work I keep telling Wendell about is, you know, you wanna jump in and do some of this stuff, and it means more. And the other two are 3 foster kids that I chose to raise, me and my wife. And then up on the right-hand corner is, of course, our older brother, you know, and me and Wendell trying to be by his side as he was recognized for some of the community work he's done. So,
okay, and just a quick note on my end. There's a picture there of our son Wendell Jr. as we are now officially empty nesters. He's getting ready for college, and of course, that also my beautiful wife Lori, who's actually a Pacific Islander. Also indigenous, and then our daughter Joan, her awesome wife Erica, and our daughter Antoinette. And again, our family is huge, you know, and this is just our immediate family. We haven't showed you a pic of our 9 siblings, and we could go farther, but again, just to kind of set the context of our presentation of who we are. Next slide, please. Okay, so here's kind of our outline that we're hoping to do is we need to kind of tell you a little bit about the Menominee Nation, the school district. We're going to roll that into the whole historical trauma piece, and then lead that into what that looks like at a community health standpoint. And then, of course, this cross-sector collaboration that you know we're all really trying to do. And then, of course, we're going to get to We've added some work around COVID because we've all been affected by COVID. And so we want to talk a little bit about the challenge and some of the progress we've made in that. And as Jerry talked about, we really need to share those results and validations. And he's always got a good point when it comes to why we show the video.
My point before to Lindsay was if we mess the whole program up, maybe the video will bring us back together, but we promise you we'll be on our A game. And so.
And then we'll get to lessons learned and Q&A. So let's go ahead and get started.
So we'll talk a little bit about the Menominee Nation. We are the oldest continuous residents of the state of Wisconsin. And just a little history, you know, we inherited lands all the way from actually out by Illinois. And before we were settled, we got moved around with the federal relocation. So we actually settled kind of in north central Wisconsin to our current reservation. So we have a population of about 9,000 tribal members. And those of us in Indian country, we get used to those ones who reside on Indian country. And unfortunately, what happens is you get ranked when you're a county. So we'll share a little bit about our rankings. We're ranked 72 out of 72, which means we have the poorest health. But we may have the biggest heart of the whole state. That's what I'll say. So,
And maybe in the top 5 in hope and resilience. Next slide. Go ahead, next slide.
okay, so what we like to share is
Back one.
back. We cherish our forests. When our elders took this final site that we were blessed with a forest. And we've been able to maintain it over the years to us. And we put pictures in there because these are important to us. They represent our floors that were for the Final Four for the NCAA. And then we also recently had one that was with the local, what the Bucks, what do you call it?
Right.
D-League, whatever.
Yeah.
So we're proud of that, you know, we've been able to maintain that forest and they're used for products that are shared throughout the country.
Right, and that also was international because our floor was used in the past Olympics. So next slide. Okay, and just a little bit about our school district. I mean, we're a young school district. We've only been in existence for 45 years. Okay, and you know, we've got about 1,000 kids, 3 schools and a student health center. Predominantly, we are mostly Native American. The uniqueness is that we are a predominantly Indian school located entirely on Indian lands. Okay, we are not a BIE school. Okay, but you know, given our socioeconomic status, you know, most of our kids eat free. Our school board makes it real easy for everyone, so there's no stigma. Everybody eats free. And this year we even did something new. And we didn't realize how big of an impact it was going to have is we start doing a salad bar every day for our staff. And it just was a big hit. So next slide. And you know, just a couple other quick data points. You know, this whole thing about the finish line, which we call, you know, the dropouts. And there was a time when we got that stigma of being a dropout factory, but as you scale back, you know, we know what we're dealing with. You know, we have a high sped population. I might argue if I knew 20 years ago what I know now about ACEs, I'd probably tell you it didn't matter whether our kids were on an IEP, they were affected by adverse child experiences in some way or another, but we have a high chronic absenteeism rate. Some schools are used to using the word truancy. We don't even look at truancy here because some of our kids have different situations of why they're not in school. Give one example, we have some of our high school kids who they couch surf, they live home to home, or they're helping with younger siblings. So we have to take that into account. We really can't count that as truancy. So you'll get more of these types of examples as we start talking about our cross-sector work. So go ahead. Next slide.
So you always hear the word, what's wrong with you? We don't like to talk about that. You know, in the ACE world, they want to say what happened to you. And think of our histories in our communities and what's happened historically with tribes, and we'll pick on, not pick on, but just showcase what's happened to us Indian people. And we've lost a lot of land, and when you start losing your language and culture, and that does affect how you do in just your normal day of life. And a lot of attention has been placed on the boarding schools. And I tell my brother, you know, we were unfortunate. There was a federal boarding school and a Catholic boarding school. So he had two choices. And then for Menominee, we were also terminated as a tribe. So you can see we've gone through some struggles. We've had some opportunities to work through, but what we will share with you is some of the resiliencies that we've worked through. So
Right. So what you're going to see next is the story of not just of our response to what happened to us. So next slide, please.
okay, and what we struggled with is, you know, we wanted to jump in and find some things that were going to work right away. And a lot of times when you get in these collaboratives, I understand you got 5 that you're working on. I think when I think back 15 years ago, when we sat down with community engagement, that's what we were looking for. And then we had one of these, I don't know if there's any epidemiologists in the group, but they kind of brought us back down to earth. And we realized that they talk a different language, but what they do is they try to make you kind of process things and look at data. So what we're able to do is to start finding these data pieces. So you can just see, we talked about the historical trauma, and some of the pieces we start looking around is personal trauma. Think of death. You know, some families have horrific deaths that they've had to deal with. And one of the topics that I know has gotten a lot more attention is this whole issue of racism and how we're dealing with it. And I can tell you, when I went to school, there was racism in our schools. We dealt with it, but just kind of got elevated more. And then, as Wendell talked about, we added in trauma of COVID because we didn't realize what that was going to do to our communities. And, you know, so for us, is you put all these pieces together, then guess what happens? Here's the stress, here's the pain, and look what happens to how, if it's not processed in a healthy way. Our substance abuses, we're dealing with horrific addiction numbers, but it's not just us, it's people across the country. And then the unhealthy behaviors, you know, we have obesity. The child abuse and neglect is really one of the stats that I think got our leadership saying, you know, what's the message they're giving our community? If we can't protect those kids, they can't protect themselves. And that's where on the bottom, if you look at a lot of communities, we're doing things right. But sometimes in those tribal chambers, they don't see what we're all doing. So what we tried to show on the bottom is we're doing a lot of things, but maybe we're working on our own agendas, you know, working on our own silos. So what we will show you is some of the work that we did. So anything else to add?
Yeah, just quickly, I want to add, when I said before that we were a dropout factory, what that term meant was schools who graduate less than 60% of their kids on time. So we were starting to peel back that onion years ago. These were the things we were starting to find. This was behind our dropout problem, which helped us understand what our response system was. But and we're going to talk more about this whole thing from COVID here. But boy, did this really change the way we needed to respond, because it went back to that distrust that we have with the federal government, even in something in terms of getting shots at arms. Okay, we had to really work on rebuilding and reconnecting that relationship. So
make sure you tell them about our own personal struggles.
Yeah, and I just want to mention, and I think this probably resonates with the 200 plus, or maybe the 400, is, you know, this whole COVID thing. We lost 2 brothers 2 years ago within 3 days. And it was this whole thing. And again, trying to, you know, lay your 2 brothers to rest during COVID when you had all these restrictions, it was extremely difficult. One of the things it did, though, of course, is it brought our family together. And it was unfortunate because one of the deaths we were ready for, our older brother. We weren't ready for our younger brother who took his life. But we certainly understood what was behind that. And it's kind of helped us in our our healing as we're moving forward. But it isn't just our family. There are many families in our community who have suffered, still suffering, and we certainly know what that impact has been across Indian country. So next slide.
Oh, perfect storm. Well, we talked about that health rankings. Okay, remember that number I gave you, 72, couldn't get any worse, you know? And at the point where we said we need to do something, you know, we tried to do some different analysis. I couldn't keep building bigger clinics, even though I did, you know. We went from 6 exam rooms, we went to 12 to 25. That wasn't the answer. I was still bringing in people who were unhealthy. They didn't have good health outcomes. And finally, we talked about getting these state rankings. You know, the state put this rankings up, and hey, we have to live with it. That's the way things are, right? But we needed to do something different. And we talked about, can we do anything different with any partners? And the most natural one, not because we're brothers, it's because of the school. And he talked about, well, the kids are there. Maybe there's something we can do working cross sector. And that was kind of.
Yeah, and I'll only add that in the school system, we have kids from 8 to 3. Okay, and if you put a mathematical equation to that, percentage-wise, they are in school 14% of their life, 86% of the time they are elsewhere. So you don't get a lot of time in that 14% to really make an impact. So that was this whole perfect storm of saying, we're not talking school reform. We're not talking, you know, if you're trying to address the state report card or the health rankings, you got to do community reform. And that was the perfect storm. And it just so happened that the American Public Health Association validated this. And you'll see that, and I think it's in one of the slides, but next slide, please.
So a little later on, they validated, but it kind of got us thinking we need to do something different. One of the bigger things we looked at was what's driving this work. And so Wendell, I think you offered up some training, you know, so how do you get people to the table? Well, you invite them with some programming. And one of the big things he brought through us was the Bridges Out of Poverty training.
Right. So what happened was when we were designated for a school of improvement, they want to give you some money to fix that. The state did, state education department. And we said, we'd be happy to take your money. Okay. But we can't do school reform. We have to do community reform because these same social determinants are what's impacting children's ability to come to school, behavior, their ability to learn. And they said, and we said, if you can hold us accountable for that, then we think we can make this work. And you know, they rolled the dice, and we got the money, and we made good on it. But again, this was the framework out there that we felt would work best for our community. Not everything. Okay. Again, we only took what out of Bridges, what made sense to us, which we could say, we could use that based on our uniqueness and our needs in our community. Next slide. So again, I mentioned how that came, and it really, if you think about it, you know, we were treating all those years, we were treating the symptom, you know, instead we were trying to get to the root cause. And even then, when we were starting to look at the poverty, the pregnancy, the alcohol, drugs, we didn't know where we really were trying to get to was the whole historical trauma piece. So next slide.
So some of the opportunities we talked about, I think it's important that we got to be good partners with the schools. As you say, you know, you give us a little, and what I think helped us was you were training more of a bigger group. It wasn't just a clinic, it wasn't just the schools, we brought in other partners. And then you needed to dive down to the people in the trenches, as we say, so more engaging those families. And I think it was probably one of our things where aha moment we thought, we're on the right track. I feel good about this. But like anything else, you need to get this aligned with something bigger than the school and the clinic. So what we were able to do is to get our tribe behind it, our tribal council, tribal legislature. They adopted this model, and that really kind of gave us the okay to get moving, right?
Right, and what I would just add to this, what Jerry has put out there is our response to AHA process and Ruby Payne is we can take some of this and make sense out of it, but it has to be done in an Eastern way, not a Western way. And if you agree to that, then we will use what you have that works for us. We didn't use everything. And she agreed. So next slide.
So what we want to share with you is some of the models that we came up with. These kind of are actually our first one. Then I think we did the trauma one after that. But we just want to give you a little picture, because sometimes people can see better through pictures. And you know, these are some of the models that I think help guide us through our whole work. So I want to go through them briefly, and we will share this with you, so you don't have to take too many notes. And granted, me and Wendell weren't the artist on it. We had to capture someone else's skills on this. So let's go to the next slide. Okay, yeah. So just think traditionally, we used to be healthy back in, you know, the early developments. You know, we used to do the hunting, the fishing. We did all the good stuff that, you know, kept us together. We were in harmony. We worried about our families, our other structures. It wasn't about the individual. And so traditionally, you know, it just signifies that we were in balance. I think that's the word we use in the Indian way. And so keep moving. We're going to try and catch up here. Okay, so the next slide. And then what happened to us? So if you look on the bottom, you know, you talk about the boarding school, the termination, and look towards the middle. You know, you got that poor guy going down the center, and you hope he stays in the center. But what happens? He may go to the left or right, and that's usually what we're dealing with, is this family issues, mental health problems, abuse, and addiction. So what we realized is those were some of the symptoms that were happening because of we didn't quite understand where we were going. And so we have unemployment, we have AODation, like everyone else. So what we needed is we needed a fix. What are we going to do about it? You know, I'm tired of just talking about it.
Yeah, and really what we were hoping to do is somebody needed to go jump upstream ahead of all this. And that was kind of a push that we were looking at. Next slide.
And this picture depicts that there's surrounding and support surrounding, and this usually comes from families and friends. So what we want to show is you can get back down, moving in those healthy ways. And we talk about with some more resources coming from gaming. You know, tribes were able to maybe increase their capacities to do different things. And we just thought that this kind of depicted that sometimes people don't get back on track and they need a little pushing. Sometimes they need a little pushing from that court, you know, those are realities. But we at least have a model that we can get towards the health and trying to get back to that healthy way. All right, next one. And then the last one is kind of the future mission. As we see, it's happening, and it happens at a little slower pace than maybe what people would expect, but we're moving in the right direction. I mean, a lot of times we see in Indian country, if we have a plan, we need to get there. Sometimes you take these wins one by one. And I think of what we've done on this abuse and neglect. Well, if I'm going to change things, well, then maybe I should take a couple of those kids. Maybe I can change how they raise, you know, it can break somebody's cycle. So we're going to talk a little bit more about a healing model, but this kind of depicts where we're coming from as a community, which I think kind of sets the stage for a little bit more to work.
Yep.
Okay.
Next slide. So we will start with the academia here of this word community engagement. And again, there's a lot of different definitions. You know, it's got collaboration. It's got about, you know, issues that affect everyone, you know, communication, sharing, you know, that's kind of that academia part. We kind of made sense out of it in our own way through conversations with our stakeholders in the community. Next slide. And it just happened to come from one of our elders attending a historical trauma summit. And he just listened, you know, like wise ones do. And he said, so really what you're saying is you need to take, you know, the healthcare, the schools, the courts, and you need to connect everybody. And he added, and you need to do business differently. But what a humble guy. And, you know, someday we'll put his picture up here, but right now he would prefer to be made, you know, kind of that person in the back. But really, that's what it really means, is how do you connect all these dots?
Okay, that's about it for me. I think if we go to the next one, we want to talk about jumping in through some of the community engagement work and why we do it, you know, our statistics, we got to get to our health outcomes. And I know I have a big challenge. It's probably going to be hard for me to move to 71 in my lifetime, but maybe my grandkids might have a better situation. But we just worry about these stats, you know, we own them, but we need to find ways to get more towards that health and wellness and living life in a good way. So,
and this is across Indian country.
Yeah.
So next slide. So, you know, if you look at it from the school standpoint, you know, again, with those struggles in the community, this is what plays out into the, you know, 8 to 3, and you look at the achievement, and again, kids not graduating on time, but really getting that understanding of those social determinants are what are impacting student achievement. So next slide.
okay, so we did have a little smartness in us. We thought, well, this all sounds good for me and you, but who's going to believe us? You know, and you know how those natives are. They like to bring down those families. You know, so we realized right away we needed to expand this work. So in our thinking, it's about the stakeholders, the community people, and then we just kind of went around with our partners. And these are the partnerships that we're working on with community engagement. So if me and Wendell could be the champions of it, we could start. We could be the champions, but you needed to get all of these major players involved. And not that we're not complicated enough, but we have a county government system that kind of we have to jump through hoops on. But you know, our college on the other way, so we're really trying to engage them and our tribal sawmill. So that's the work we see, trying to make sure we branch out and connect with our partners.
And then one quick point just to add before we go to the next slide. This here is under a public health care lens. We don't use the school lens anymore. When we tried that, it was a school issue. You deal with it. When you use something like this and you operate under a public health care lens, nobody in that circle can hide. So next slide.
Okay, I mentioned before, I think I mentioned it to Lindsay when we had that breakout session, we had talked about something. This is gonna work if you can align it to something bigger. And what we're able to do is we actually had a couple in services with the tribal administrator, and he liked the idea. I said, well, if you like it so much, why don't you adopt it? And what he did is he put it on as it tied the whole community engagement, bridges out of poverty into the tribe strategic plan. And it really kind of laid a foundation for us that, and we developed mission statements, and we developed, we've done yearly outcome. But the bigger thing that I think we've been able to do is create 90-day plans. So that holds you accountable. You ever been to a meeting and you talk about the same thing for the last 3-4 meetings? You've been through a lot of those. And we said, we need to flip on how we do business. So we came up with this 90-day plan, and it seems to be holding a lot of us accountable for making sure we follow up on the work we need to do. Okay, next slide. So of course, you know, we were still back into, well, we better do something if we're gonna do this right. We need to tie the school and the clinic together. And one of the first initiatives we did is, I give this guy some, give him a shout out. He was our chief dentist, and he talked about, well, geez, if the kids ain't coming here, why don't we set up a dental clinic in the schools? Okay, well, go at it. Then you tell me what you need, and we'll do it. And he was able to talk to the superintendent, and we were able to get, I think, a dental chair in each of the 3 schools. And boy, did it get started. I got a little, we'll show you a chart a bit later. And then the other thing is with that Safe Schools program, you added in a component on behavioral health.
Right, and just going back to the dental, we were actually able to convince the Department of Public Instruction in Wisconsin that unmet dental care needs impacted student achievement. And we actually got to use some Title I dollars to help fund this. And then, of course, with our Safe Schools dollars that we received, you know, that came out from SAMHSA due to the Sandy Hook tragedy, we started a conversation, and we built our own student health center right on campus. But this whole thing of the kids are in school, just bring the services to the school. Okay, make it easier for the family. And we got a nice graph to show you some actual data point around that dental care that Jerry's going to talk about here. So next slide.
And we just wanted to share with you, of course, you always use the IHS data. And then this is what our statistics look like back in 2009, 2010. And then we got work going. So from 2019, you can see our numbers decreasing. And those are dental caries. And so I think it tells us it's working. We need to maintain it. We got to sustain that work. And so, you know, Wendell's happy as long as I can provide him hygienist. So what we'll do is we'll get the hygienist over there with an assistant, and then we'll circle around and bring a dentist to do an exam on the kids. And then they can come over by us to do treatment.
And then just to add to this is you've got behavioral health in the schools, you've got the dental care, now we've got optical. So now we've got an optical department right in our elementary school, but guess what? High school is saying, well, we got high school kids that need optical service. So there's another, but again, you're doing all of this within, that's why I love the concept of community schools. Okay, so again, I think this is just good data to show you how one cross-sector collaboration can work. So
Yep.
next slide.
All right, COVID, it should be, right?
Okay, so we wanted to spend a little bit of time about this whole thing around COVID that has really impacted not just, you know, the country, but is really affecting Indian country. And I think we've got some things we want to share with you that we've done in our community that hopefully will either validate or challenge maybe what you're dealing with in your community. So next slide. So you can see that it goes back to that first mental model. Look how it has affected, you know, we know that it shouldn't have really come down to a pandemic to, for us to say those health inequities, especially in indigenous communities, were already there. Okay, shouldn't have took that, but it did. Okay, but you can see that whole impact of what it did to us in terms of hospitalizations and death, it was tragic. So next slide.
One of the things we did is you want to keep and contain people outside. So what we plan for is a drive-up pharmacy. Okay, so if you keep people out there, then they'll have to come into the clinic and stand in line. So we staffed up. We call them pharmacy runners. We built some portable units outside, and then the other thing we did is for the testing to keep them outside of the clinic. You would have a couple pods out there, and if we test them, and then if they needed to be coming for treatment, you'd have another room to triage them. And that kind of, I think, kept our numbers down. What I was talking about with the clinic was we were essential providers or services from day one. We didn't miss any day of work because they needed us. We just had to find a way to do business, you know. And then we are just big on vaccinations. We have nurses who are really passionate with us, so working with the schools, right? And setting up vaccinations. I think we had the third highest vaccination rate. So we did everything we could. You know, we had, I think, over 40 that we've lost, unfortunately, and maybe half of those were on reservation. So, you know, it tells you that COVID did impact us locally.
Next slide. So a quick community or a quick response that we looked at from the schools is we didn't rush to online learning like everyone else did. Well, we weren't ready for it. First of all, you didn't have Wi-Fi connectivity. We had to redistribute, you know, we had Chromebooks, but it would be kind of useless to give a kid a Chromebook if they didn't have Wi-Fi connectivity. So we took a different approach. We worked on getting these hotspots into communities, but we started with the basic premise of let's make sure our kids are fed. And so that was our first, what would you say? Our first response is let's make sure our kids get fed. We can also communicate with them while we do that. And we might even, who knows, we might pick up a few more things. So again, our approach was a little different, and then that gave us time to get our Google Classrooms training, get some Wi-Fi hotspots. So next slide. And again, once we got that established, you know, as Jerry talked about the drive-up pharmacy, here's our high school principal that would actually stand outside in front of the school, and parents and kids could drive up and whatever it was, talk, schoolwork, whatnot, but it was basically the way to show that, hey, our doors are open. We were eventually able to get to like learning centers where we could keep the school open just for a couple hours. But again, you had to bring kids in, which we were willing to do. And then it finally got us established to where when it came down to running these mobile classrooms, we were able to do it, still with not the greatest success, but at least we had something. But again, the big part was we needed to stay in contact with our kids any way we could. Next slide.
All right, so we're recognized for some of our work. I think the State Department of Health realized that the boots on the ground people were important. So we had a fairly good relationship with our state health people. And this was just a recognition of all the work we did. So me and Wendell are part of that circle, along with our medical director, who had so much passion to try to deal with this. And then was our tribal chairman, and then I think it was one of our secretaries of Department of Health. So always good to get the recognition. You know, sometimes your staff worries about, no, you are appreciated. So,
and then this one came just a few months ago from the National Organization for Homeless Children, spotlighted our work on how we responded in the pandemic in our school system. And, you know, we told our story, but you know, really what was behind that story is we just kept doing what we were doing. We just changed our delivery systems a little bit. So we got a validation there, which we feel is important. But next slide, please. So I want to just take a few minutes and talk about this because it goes back to what was said in the opening, and I like that is because here is, and if you got school people on here, you should recognize this. This is really a tiered response to intervention model, which we put more in a linear, because natives, we think in circular motion. But if you look at, this is what we've been doing in our school systems. And again, I'm not going to read everything, you'll see this, but you know, safety is a big thing for us. So we spend a lot of time on this daily mindfulness, and I think whoever did that for us with some deep breathing before we started today, that really helped ground me. But we really place an emphasis on checking in with kids before they get into the classroom. Okay, so important. But as you look at these things here, these things are not, I mean, you probably will find them in all of your schools. It's just, again, it's how do you connect them to your community. So I want to take a few moments and talk about this right here, because this is that cross sector. And we thought we were really moving before the pandemic, and then the pandemic hit and this got put on hold. And now we are just coming back, which is good. So we are now back working with our family services, our youth services, our tribal legal department, and our schools, talking about early school attendance. And it's kind of nice now because we're able to get people to understand what's behind all that. You know, we don't want to be calling, we don't want to be referring families to the courts for educational neglect. We just have to work harder to find out what are the missing parts, what are the missing resources. You don't do that unless you get out there knocking on doors. You don't do that unless you go out there with the intention that you're not there to take their kids away. You're there to help, or should you say you're first there to listen. So again, we have found that this type of response system has helped our student achievement outcomes by far than what we've ever done before. And again, some of these are changed. They get changed, but you can see mental health engraved in here. You can see language and culture infused in here. You can see how we hold students accountable for their behavior through a restorative practice approach. And again, where we really get into that really critical area around mental health. Okay, so I just want to let you know that this is something that we update every year. And again, we're starting to feel pretty comfortable now with how this is playing out. Next slide.
okay, so if we could breathe again, what we want to share with you is a model that as we got our community engagement group back together, because last month or so,
yeah,
we basically kind of got this endorsed from the stakeholders again. And we've been fortunate that we have a PI, we'll share her name later, Dr. Alex Adams, but we were tired of just looking at the trauma stuff and when are we gonna heal? And so ultimately what she did is, her and another of her colleagues came up with this by listening with us, being an active part of our community engagement. And just think of, if we don't have hope, how do we come to work? If you don't have hope, how do you go to school? Just all this thing. And we just love the concept of the hope. And then when you shared the slides on joy, man, that was cool just to see the slides on. Sometimes we just gotta take a little time to recognize the joy in our circles, in our community. And we usually get too busy about it, but I think we're fortunate that we can use this model, because now what you're seeing is kind of going more back to our traditions, our cultures, and reclaiming identity, which I think is important. And then Wendell said you want to talk a little bit about creating the community connection, right?
Yeah, and I think just the biggest thing about this whole thing around relationships, and again, go back to Bruce Perry, the work that he does, and he talks about relationships heal people, our people heal people, not medication, not counseling. And so we place a real high value on this whole thing about relationships, especially with kids from trauma. Next slide.
Okay, we'll try to get through this. I know we got a video to show and then we got some questions.
But here, I just want to add, we were once that dropout factory. Here's our marker right now. We're graduating kids at 90%, if not higher. This year it's 93%. So we're real pleased with that. So next slide. And you can see that we recognize that you can't suspend your way out of this. So our approach, our suspension rates are actually higher, are actually lower than the state average. And of course, we had a documentary done on our work here that if you get some time, you can take a look at it, but it's really giving you a lens of what trauma responsive systems look like in a school system.
Next slide. And we just like to share with you, we do get some validations on the federal side. So we've been working with a guy by the name of Dan Press, actually a good friend of ours now. And some of our stuff has made it up to the Hill, which we feel, hey, this is good stuff. If those people feel it's good stuff, then hopefully your tribal leadership makes it good stuff. And then, we talked about our partnership with the academic area, and we were fortunate with Alex. Alex used to be at Minnesota. I think she moved up to Montana State, but still a good friend, still active, involved. But in this work, and I'm sure you've done it in your collaborations, you have that academic piece. And sometimes we get lost in the academic piece because we want to go to, I just want to make it real for me. And so Alex has been a great partner, and we're just fortunate that she continues to work with us. So next slide. And of course, the APA, Robert Wood Johnson, that really helped us. I think sometimes when you sit and struggle, we're making any progress, brother. Well, guess what? Robert Wood Johnson thought we're making progress. And to this day, we still have connections with the Robert Wood Johnson piece because they asked us to be ambassadors for the work. So we continue to. I said we should tell them how many times we showed that video. That's still being an ambassador.
And here's that Vietnam veteran with the wise words. We took him to New Jersey with us when we received this national award. So anyway, next slide.
Go ahead, yeah. We just keep looking for validation. So anything we can add, we put it in there. Makes it look good.
Next slide. So again, we want you to know this whole thing about there's the trauma piece that's been validated, the integrated care, and of course that same academic institution that labeled you as a dropout factory actually hired us as faculty to help do the work that we showed them. So it was kind of it was enlightening. So next slide. Okay, so now we're ready for that 7.5-minute video that hopefully will fill in the blanks there.
To understand the Menominee Nation, look to the land. Of the 9,000 tribal members, 4,000 live on the reservation. 350 square miles of pristine forest, lakes, and rushing rivers in northeastern Wisconsin. The Menominee Nation has been sustainably logging the forest for generations, but a congressional act in 1954 terminated the tribe's status as a sovereign nation and made their land and self-governance vulnerable. The reservation hospital, schools, and many services were either closed or scaled back. The Menominee Nation won back its status as a federally recognized tribe in 1973, but the period took its toll. Now, the Menominee Nation is rebuilding a culture of health with collaboration between tribal government, the health clinic, and the youngest members of the nation.
We've been here approximately 12,000 years. This is our world, and we're here forever. So we need to make sure that this world stays healthy, not only for us and our babies, but for 7 generations going forward. We're to try to judge the impact in any decisions we make.
So we start realizing we have to change our approaches to how we're gonna heal. And that's kind of one of the things we talked about is we can't do it ourselves. When people aren't coming to use your clinic in a preventive mode, it's more crisis oriented, then we're not delivering that care. We're not being patient-centered. We got to find ways to connect with our patients.
Welcome, everyone, and today we are going to try on the second page.
What we need to do is to develop this coordination team within the clinic.
A lot of medical visits, a high percentage of them are related to trauma. Was there neglect in the home? Was there not enough food? Was one of the parents incarcerated? And trauma has a wide-ranging effect, both in mental health but also in physical health.
Textbooks that they're going to be using.
People sometimes kind of shame people or condemn them into, you got to take better care of yourself, Well, that's not very helpful. That's not trauma-informed. Trauma-informed says, they're doing the best that they can. At any moment in life, people are doing their very best. Now, that doesn't mean they can't do better, okay? But, to do better, you need a little more support.
For me, it's an honor to work here. It means so much to me, just coming from this community. So just to be a role model, I'm hoping that carries over enough to families and people that I know that, they can make positive changes in their life.
That's what you're seeing now is more of a effort to transform how we're doing business in our agencies and be more trauma informed as we deal with our clients, because we have to heal, and if we can heal, let's heal those kids. Let's see if we can heal kids, because kids eventually become adults.
In our school system, we educate the whole child. If we open up our doors and we bring in the dental clinic, we bring in behavioral health, we bring in nutrition, all of those things are connected to kids doing well in school.
Yeah, really working on instilling good habits at home with these kids. Keep brushing and flossing. Okay, I'm gonna sit you up, all right? Great job. All right.
We don't know what their day has started like. We don't know what happened here on the playground. We don't know what happened on the bus ride in. We don't know if something was upsetting to them in the neighborhood or at home.
Move our name over to how we're feeling today.
But if we can come in and they can say to us, hey, I'm feeling pretty happy today, I'm going to hit that happy face, or you know what, I'm a little concerned, or I'm a little worried or upset, I can hit these little buttons and I can give my teacher a signal of how I'm feeling. One of our new initiatives that we started last year that this year we've made some huge change to is the Succom Room, the Menominee word for peace. For some people, you might think of this is timeout, this is the timeout room, this is the in-school suspension. Well, ours is different because in here, what we're doing is we're recognizing the emotions of kids who are coming in that are dysregulated. We're meeting the kids where they're at. We're acknowledging the emotions that they have. And when we're able to do that in a very calm setting, when you've got trained educators. You've got to get kids out of the red zone to green and yellow where learning can take place.
6.
When you have data that can back actual results from whatever the initiative is, all of a sudden you start getting that belief and you start having that pride.
Because if you respect, you're going to get love. If you respect, you have wisdom.
We've got kids who've got a lot of grit. And what we see is when kids are graduating through our system now like they are at above the state average, that tells us that our kids are resilient, but also it tells us our kids are healthy.
All right. I want to let you know you will have to unmute. I muted you during the video.
Yes.
I just want, oh. I just wanted to say that I was writing it in the chat, but I'll go ahead and say it. Kate had mentioned, Kate Seuss, that she loves the peace room. I love the peace room also. And I even love it more that when you talked about it, you talked about it as not being that timeout space. So many times when we create that room, it's looked at like it's the bad room or it's the bad space. And so I am so glad that you said that, and we others that have incorporated that. That's a great point to make sure that we're not making it seem that, you know, it's that bad space.
I'm going to build right off Lisa's point here, right from a school standpoint on a lesson learned, is again, you'll never suspend your way out of this. And if we've got schools on here, I hope this either challenges your thinking or validates what you're doing, is by moving the accountability piece of behavior to the end or after, when kids are when you can have a conversation, you have a better chance of holding them accountable. But when they're angry, that is the worst time, okay? And again, through our indigenous thought, through restorative practices, actually, when you find that you put these systems in place, what gets healed aren't rules. What gets healed are broken relationships. And to me, that's the whole cornerstone of our work. But, you know, just to mention quick that all through this effort of COVID, we've just learned we had to regroup, we had to recharge, and most importantly, we had to reconnect. So I'm gonna let Jerry finish this out here for us.
All right, next slide. So I think it's important that you talk about, we're building a story, you know, stories start and going to be a start and end, but in the Indian way, you jump in the circle somewhere, okay, and then you just be a part of it. But I think it's important that you find leadership, and we were fortunate that we were able to get, I think, our tribal chairman, we got a tribal administrator. If things are going to work, you got to get the right people, because Lindsay or Susie or whoever, we don't have all that position forward, but they do. And that really helped us as we move this effort. And then you continue to need champions. You know, I'll say you got 2 champions here, but that ain't gonna cut it. You need more champions out in our community. So we continue to work on, like my health board or his school board chairman. And what we continue to do is to validate. So, you know, we know this isn't the end, we know it's not, but you know what? It makes you feel good. There's some hope in us that some of the work we're doing, and we just feel that every day when we get involved. What was the elephant in the room? Oh, okay. We took kind of some soft approaches, but I think the approach you know, we said we needed to do some of this youth obesity stuff, teen pregnancy before we got to the hard issues. And I think the hard issues for us are those AODA addictions. Yet when you look at bringing different agencies together, it's kind of those silos. You know, you're in it for your own. And I think what we kind of did is kind of leave your agenda out the door. And that's hard for people, right? And so we said, well, if this is going to work, it's because of the stakeholders and the kids. Right? And so.
And it took us about 5 years to where we could talk about the substance use and the impact it had on abuse and neglect and how we could trace that back to historical trauma. Okay, that's the elephant in the room is the historical trauma.
And it's painful. And it's painful to talk about. When I always like the word used, when you peel back that onion, there's a lot of hurt when you peel back, right? And you need to have capacity to deal with that hurt. And that's what I think we were a little worried about, because we didn't have everything in behavioral health that we do now. But we've shifted. So I like his approach about shifting. We call it pivoting. You may have to pivot because COVID taught us to pivot every day. And I think as an organization, we're having to kind of pivot through this.
Okay. We got one last slide to show you. Here you go.
Okay, so here's that wise wisdom keeper that told 2 of his nephews that someday he had a vision for us, and this is our uncle who was he stepped in for our father, but he was also on the tribal council, and he just could see this vision that we couldn't see. And but if you think of a saying, the further you go back, I mean, look at our history, and what you're starting to do now is to heal from that history that was painful. Boy, I mean, that guy he had vision, you know, and we were just fortunate that he was able to give us that guidance. And you know, he was smart in his way, because before he left us, he transformed that back, because he raised the bar for 2 of us. And I think to this day, we're learning that, you know what, brother, we're gonna have to pass it on to our nieces and nephews and our relatives. And it's a good way to pass on that transformation of the wisdom that we have in our communities.
Okay. So we are now ready for some Q&A. Thank you for being patient with us as we're trying to get through this, but our contact information is on here. Feel free to email us. We're happy to try to answer any questions or respond any way we can.
I'm gonna leave that up to Lindsay now, so you shoot some questions.
Yeah, me good. Thank you both. We do have a few questions that we'll start out with that were asked during the presentation, and then we'll open it up to hear other voices and go from there. So the first couple of questions are really around that 90-day plan that you talked about. The first being, what does that 90-day plan look like in practice?
Let's see, I don't have one handy, but basically what it is it lists your goals and objectives. You have a work team, and you know, kind of like a grant. You know, grant has deliverables. So what we thought was important is you assign a objectives, and then we give updates. So what we were able to do is we would have these 90-day plans, and then we would come back as a group. We would report out. So who'd like to report out that you didn't do your job? You didn't want to do that. So in a way, we try to get our homework done, as Wendell would say. And it really, I think, kind of got us thinking that we got to take this serious, because I think we started in a lot of our community engagement where we were just stuck. And we just needed to focus on, and that instrument really helped us think move a lot of the work that we're doing in the community.
So what we can do, we just had our first community engagement meeting in person a month ago. We are now updating the new plans. We will send them to you, Lindsay, so you can share them. But really what happens is you meet 4 times a year. We meet at our casino. We share the plans. We hold each other accountable. Then we write new plans in between. So we will share, as soon as our community engagement coordinator updates those, we will share those with you so you can share them with everyone else.
We're so thankful. I remember that from last time around, just how willing you are to share you know, that framework for us as we all get started in envisioning what this might look like in our own communities. The second question revolving around those 90-day plans. Does that 90-day plan connect then to an annual plan?
I think when you looked at our mission statement, I think you can see the connections of what we're trying to work to. I think the mission is continued collaboration. And as long as you continue to collaborate, I just think we're not being held, there's not a grade for it, but what it does show is there's a lot of things happening. And I think our facilitator made some observation that as I come back to the circle, I feel like your community is re-energized again. So she can feel that. It's kind of like we're stuck in the trenches. We don't see that. We're here every day. But as an outsider, so what I think you need to do is to make sure you communicate those updates to your leadership. And that's what we've tried to do, is get on a regular schedule, let our leaders know. Our chairman actually came to the meeting. I was chatting to him one day. I said, just do me a favor, come there for half an hour. All you gotta do is make a presence. And he did. So what we're finding is we're having to kind of reorient to new members. We're the old school, and I don't like to brag, but I've been at this for 37 years at the health center. It's been a while for me. He's a little younger than me, but it just seems like we have to continue to find those champions, right?
And what I would add is, when you say, is it connected to an annual plan? What we do in the schools is, obviously we can tie this to budgeting. So we actually budget dollars in the school for our cross-sector work in the community. That's one. But the other thing we do is, when we have to write our school improvement plans for the state, we are able to share that work around community engagement. We like to use them, call them exhibits or whatever, but we use it in our state accountability system. So that helps us.
And one other thing we do at the clinic is, as part of our orientation for new staff, is we walk them through this Bridges model, and also the new one with the ACEs and the TIC training. We actually have a gal, the ACE master trainer, who will train up the new staff. They do an in-service at one of our resource centers. So that's kind of how you embed it right in your organization or your departments.
We so appreciate that being named. Also, I think that's kind of what we've tried to do here in Minnesota too, is to really help build capacity, right, within organizations, embed them within policy and just organizational onboarding. So that way, that's going to continue. And those are the sustainable pieces that are going to continue to really make that difference across the board. So I appreciate that. Thank you. We have a question. When you were mentioning the dental provider example and really having that accessible right at the school, there was a question about the providers, if they were local from the tribe.
Okay, what we do is we'll send one of our dentists over there. Unfortunately, we're able to hire a pediatric dentist, so we'll get the pediatric dentist to go over and actually do the exam. So he'll work with as assistant, and I think there's also a hygienist there.
Yeah.
So we feel it's important. And then what you do is, in some of them, and as you heard the one therapist talk, there's some severe cases, and we may have those for dental. So we actually have a pediatric dentist that can do some of the surgery in the local hospitals. And you're going to find some of those struggles with some of our kids. So we do try to hook up with those most needy. We have some at the clinic that we can do, but maybe 4 or 5, maybe about 10 a month. We're doing some surgeries at the hospital.
And in the years that we have done this, the kids take a form home and get it signed by the parent. In my role as a superintendent, I get parent complaints. But I've gotten one on the dental program. Okay, not one. I mean, kid is in class, goes and gets dental care, goes back to class.
Yeah,
that's it.
And we always need to remind ourselves that there's no-shows with that process. When you go back to the clinic, it could be 10, 15% no-shows, but with kids, they just take the next one up.
Oh, I appreciate that so much, knowing that, here in Leech Lake, our own struggles with our IHS dental clinic. It's hard to get in. You have to be there bright and early in the morning before they even open to be seen. So I so appreciate these ideas being shared.
Okay.
Another kind of health school related question. Did your school system also access federal Medicaid funds to build capacity for school-based behavioral health services and in-school behavioral supports?
Okay, we only used a portion of that. Fortunately, Jerry just gave us the therapist. Okay, now we're building capacity for our mental health providers in the schools. We're getting school counselors now with more training around trauma, substance use, and where we can start using them now for some of these billable services. So we had to take a different approach. We had received some mental health dollars from the state. And one of the nice things it did is it allowed us to start giving retention bonuses for our social workers and our school counselors and school psychologists for staying. And it gave us some sign-on bonuses for our new hires. So again, as you're saying, using those federal Medicare, that's the direction we're moving in.
And I would just add that as administrator, you see where the need is. So it would make sense for me to commit those resources to help out our kids. I mean, that's kind of how I look at it, you know, and sometimes you're not going to be able to bill for some of the service. The main thing is you're helping the kids heal. That's kind of how we look at it. So you have to gauge one of those. And unfortunately, we've been able to beef up our behavioral department. So and Wendell's got a few graduates from this high school that went on to college, and now we're actually trying to train them up to be certified. So that's a nice cycle of.
Well, when you think about that full circle route, you know, this is just a quick data point. So about 17 years ago, when I started in this job as a superintendent, we had about 13% of our professional population was Native, okay, Indigenous. As we've done all of this work, this cross-sector work, and we like to grow our own here. I mean, we are up to just over 40% of our staff is Native. On top of that, we are hiring our former high school graduates to become teachers. Our first one in behavioral health, huge. So it does pay to grow your own.
They're not going to go nowhere. At least you don't think they're going to want to stay home.
Yeah, creating that opportunity and that pathway to get there is so important. I know across sectors, there always is that issue of wanting, you know, representation. And so that's so beautiful to hear. I appreciate that. We have another question. Knowing that sometimes buy-in can be an issue, right? Whenever you're doing something new or something outside of the norm. So how do you navigate adult conflicts, whether it's conflicts within teams, staff involved in the project, school staff, and do you utilize restorative practices, restorative philosophies, whether it's circle, mediation, or something like that?
Right, and I'll start first, and I'll let Jerry jump in here. But that buy-in, it goes back to champions. But when you found all that work that was about RP, that's for the adults too. Okay, we do restorative circles for adults. I tell you that there are times when we as administrators need to be checking in with the adults before they come in and teach kids. Because sometimes if you don't, they can make things worse. So I think part of that is also when you're trying to create this paradigm shift is to have these conversations about, well, if not this, if not trauma responsive, if not restorative practices, then what? And it's not going to be the same one. Then what? That conversation changes them. Okay. And again, you don't need everybody on board. You know, there's a term out there called critical mass that was used, I think, back in, I don't know which World War II or something, but it basically asserts to, you don't need 50 or 51% to create a movement. Actually, research says you get to 40%, that's enough to create a movement. Okay. But again, you get buy-in, you got to have difficult conversations.
So I would just add with COVID, I don't know what happened with our ability to get along with people, but man, we sure got short with each other. I don't know what you think, but you kind of like, man, I remember this happening 5 years ago, but COVID's just got everyone under stress, you know, and I think we realized that, a lot of fatigue, you know, and, you know, for us, it was the awareness, yet I could tell you, I could pull teeth if you could sense a department, you go around, you could kind of get these opportunities that were going, well, okay, we're going to make behavioral health available. They wouldn't go. Finally, I said, well, you just go down there and have a sit down
I think we lost them.
Uh-oh.
Give them a minute to chime back in.
Just some other questions that I know already kind of have been addressed in the chat. There was questions about accessing the documentary. And I know that Emily did pop those links into the chat, as well as they will be listed on the conference website as well. Like Jerry and Wendell mentioned, they are hoping, or they will get to us an example of their 90-day plan. That's something that they've been amazing and always sharing with us. They are very open to conversations, about further questions that you might have. And so we'll be sure to include those resources, that information going forward as we receive that as well. I would encourage you, if you have other questions, as we're kind of waiting to see if they'll be able to pop back on, include those in the chat. I know that even if maybe they aren't able to jump back in person, they'd be willing to answer those questions via email, and we can certainly share that with you also. The other thing I'll mention, there they are, they're coming right back to us. As Jerry and Wendell join back in, we do want to mention that in a moment we'll pop into the chat the information about the next sessions for the day as we continue on. So Jerry and Wendell, if you're signed back in, we welcome you back. Those tech issues, it looks like they're still joining. We so appreciate their approach. I think there's so many challenges that we could all relate to in terms of things that we're seeing in our own communities. I think that behavioral health piece has been felt even more resoundingly than ever. Just that need to really be able to meet the needs of not only our young people, but all of our community members as well. Looks like they're
Lindsay, what'd you do to us?
I was like, don't run away now. We're on a roll. Turn it back on over to the two of you.
They had enough of us.
Like at the Oscars when they start playing music, right, to get you off stage. I promise that wasn't what was happening. We could listen to you all day.
So you could go to another question, or what else you got to do? I mean, we're available to answer a few more questions.
Yeah, so there was also just a question about if you'd be willing to share even a breakdown of funding sources you've utilized. There was a participant who mentioned they work for a school district and they're usually in full support for ways to support the whole child, but funding is always an issue. And they're wondering if they can get some more details on what that might look like.
Looks like they may have fallen back off again.
I'm guessing there might be some technical issues on their end. I so appreciate everybody's willingness to step in, everybody's questions. I think that these folks have really shared a lot for us to think about today. And we are going to go ahead and get going, so everybody has a little bit of a break between sessions. As Jerry and Wendell said, they're very open to touching base about things. And as Emily put in the chat, please feel free to share other questions you might have. So thank you everyone for joining us today. The next session of this event will be the morning breakout sessions running from 11:15 to 12:15. Sessions include community and government, learning from New Jersey resilience work, fostering individual and collective healing across generations, and systems change, efforts at the state level and community level prevention. And so you can see in the chat there that we'll have the join links for all of the remaining sessions of the day. You can always refer back to our gathering website. And we just really thank you for your presence here, for your time and your attention, and how we're carrying forward this hope and inspiration into the rest of our day. So Chi Miigwech for everyone in joining us. Again, we have about 15 minutes before the next session starts. And we hope to see you back. Miigwech, everyone.